Hey, I want to let you in on a secret. Well, it's not exactly a secret, but it's something that has been a hidden gem for a while now. Martech.Health, started by industry veteran Ed Bennett. It's a site that lists agencies and tools and other solutions for the provider side healthcare marketers. And recently, Joel Cessna and Tony Huth have taken over the reins. I wanted to find out more about this, so joining me today is Swaay.Health community member Joel Cessna. I asked him about their plans for the site and why it's still needed. Oh, and you're going to love hearing his take on the opportunities that he's seeing in healthcare marketing. Let's get to it.
Swaay.Health.
Joel, welcome back to the program.
Thanks, Colin. Great to see you. Always good to be here.
It's always good to have you. I love seeing you on the circuit. We always have a lot of fun when we see each other in person. So thank you for agreeing to join me on camera today. You are a titan in our industry. Everyone sees you around and knows you. But for those that maybe haven't had the chance to meet you and get to know you, can you give us a quick little introduction and tell us a little bit about yourself and your healthcare journey?
Yeah, absolutely. So, Joel Cessna with Martech.health. What I have been doing for the past year is working with different healthcare vendors in the space. And my journey, I've been in the working with healthcare marketers for going on 16 years now, primarily in the patient acquisition and retention stages. And really enjoy working with the smaller startup type vendors, helping them with their sales process, their navigation, and really making sure that they do things the right way. The healthcare marketing space is, I would say, really unique. It's a really great industry, great people. So bringing the vendor side to the client side has really been something that I've really enjoyed for the last 16 years.
16 years. I mean, that's amazing. I mean, it just goes to show, like, so many people that we know that have been that are in the industry have been here that long and longer,
Yeah,
right?
yeah,
And it's great to see that people still have that fire after so many years of doing like what you're doing, right? You've had that fire for a while, and you keep doing it. So it's a lot of fun. It's a lot of fun to see.
definitely. Yep.
Now, Joel, since the last time you and I spoke, and since the last time we had you on the program, a lot's happened. and the
Few
big
things.
news, one of the reasons why I wanted to have you on is, of course, Martech.Health or Martech.health. That directory, started by our friend Ed Bennett. It's been running for years. You're now running that, and taking that forward. I want to ask you about that, but again, for our
Mhm.
audience, can you describe what that is?
Yeah, so Martech.health is really meant to be a directory for healthcare marketers when they're looking for a vendor. So, when you think about it, if you're going to look for a CRM, right, you have a few different options. You could do a Google search, but that's probably going to bring up multiple rando type CRMs that aren't going to be applicable. Reaching out to your network, which I would still encourage you to do and get feedback from them, or hit the easy button and just go to Martech.health. You can go into the CRM category, and then it's going to be all the CRM partners in the space that you can then research and see who potentially could be a good fit, reach out to them and start that conversation.
So it's a place where people can kind of go to get, I'll call it a curated list, right? Like
Yes.
when you go to a Google or a ChatGPT these days, I mean, you're just getting the most popular list, I guess you could say. Whereas this
Right.
one, a list that's curated by industry insiders, if you will.
Correct. Yeah, that's a great way to put it. And, we want to make sure that they are relevant and applicable to that space. So, again, kind of having that healthcare focus, I think, is important. They don't have to be 100% healthcare focused vendors, but we do want them having some percentage of their business being healthcare. to make sure that they're providing good support and service to our to healthcare marketers.
And is the idea, Joel, that this would help short circuit that initial discovery phase, right?
Exactly.
So I'll call it the equivalent of walking around the trade show floor of a ShushMed or an HCIC or a Swaay.Health for that matter. Like it's sort of that but virtual, right?
Yes, exactly. Yep. Again, kind of pushing the easy button. Just it's meant to be a starting point. Eventually, as we build it out, there's going to be a lot more that goes into it that hopefully will even help you make a decision right there. But yeah, today it's that quick directory for them.
Gotcha. Gotcha. Yeah, I mean, and it's, this is not something that sprung up overnight. Like this Martech.health has been around for a while.
2018. Yep.
Yeah, 2018. So it has strong authority out there in the internet. And that's,
Yes.
that's kind of where I was going with this. It's not just something that just sort of popped up yesterday and now you're having to build up all that authority and all that reputation. It's already got that because of the work that went on before.
Yeah. Ed Bennett did a great job, and everyone knows Ed when he launched this in 2018. You know, being on the vendor side, I'm like, oh, this is fantastic, right? Giving them a solution to really help them find vendors. Um, and it's really kind of grown from there. So, what we wanted to do is my colleague Tony Huth and I, what we wanted to do is take this platform that Ed built and just kind of bring it to the next level. Ed was looking for someone to buy it as he's kind of moving into the retirement stage. Um, and we wanted this product to continue because we do feel there's a big need in the space for it. And so yeah, we're excited to see what the next year brings.
Joel, first of all, I was remiss to not mention Tony off the top. So this the two of you leading the charge over there at Martech.health. Can you give us a sneak preview at all of where you and Tony want to take things? Are there some exciting new developments that are going to be, surfacing over there on Martech.health?
Yeah, so I mean, our roadmap is long. Tony has a very creative technical mind, and um, so some of the things that we have already done is we've really done a lot of data cleansing to the platform. As a healthcare marketer, if you're going to search for something, in the past it was really kind of intimidating because you could go to a category and there could be 150 vendors. So what we're really trying to do is make that experience better and more streamlined. So we've, cleaned up a lot of the vendors that just didn't seem relevant, that did not want to be part of the platform anymore. Focusing more specifically even on the hospital and health system space. We've also done a shifting of the categories, so to speak. So in the past, there were like 47 categories. We have changed that down to 12 now. And then in the 12, there's capabilities. So when you think about someone might be looking for SEM, the category is going to be like digital marketing, and then under digital marketing will be SEM. So kind of a logical process from that perspective. But we even want to build it out further. So, we would love it if the healthcare marketer could come to that platform, and whether they're typing something in or, checkbox type format, here's what I'm looking for. And then we kind of do a match for them, saying, here's kind of like your top 10 vendors that would match with you. Um, Obviously building some AI into that will definitely be important. Um, and then, really making this a platform for vendors on one side to be able to showcase what they can do and why a health system should consider them. But even more importantly, make that health system marketer have that user experience that's just really unmatched. So definitely going to be doing a lot of promotion. I don't want to buy into the if you build it, they will come theory, but you know, making sure that we're actively reaching out to health system marketers to make sure they're aware of the platform, that they know that they can utilize this, and that they want to come back and utilize it, not just for vendor searches, but there's a whole conference section. So we're building that out right now so people know more about like Swaay.Health and HCIC and HMPS and Shishman and all the other conferences that are really relevant for our space, that we're big believers in and we know really do a good job.
You are 100% right that is a long that's a long product roadmap, but it's great. I mean, it's great that you guys have the vision to add these capabilities there, and I like that you went through and cleaned up some of these categories, to kind of freshen it up, if you will, right?
Yeah.
I think we were talking off camera, to remove some people that were kind of tangentially in those categories and really make sure that it's focused on people who truly are like in that category and that are worth considering.
Yep. Exactly.
And I think it's important to point out that, Martech.health it's not meant to be class, right? It's not meant to be a pay to play thing either, right? It's sort of in between. It really is meant to be a trusted place where you can go to get that head start on a list of partners or vendors that fit a certain need that you might have.
Yeah, exactly. And yeah, that's the one thing we don't want to do. It's not going to be something that we charge the health system marketers for, right? Like we truly want it to be a tool for them that they can utilize. And um, it's I don't envision it being a huge revenue generator or anything like that. There are paid sponsorships that vendors can do and paid listings and things like that, but very low cost. At the end of the day, we again just want it to be a platform that, like you said, is really a trusted source that people can go to and utilize as they expand their career and knowledge.
Right. Right. So let me ask you this, Joel. If I was a marketing executive and you bumped into me at a conference, which you typically do, what would you say to me to convince me to give Martech.health a try? Like, what would you recommend how to start with when I first go there?
Yeah, I mean, that's a great question. So, I mean, first of all, again, I would say it's free, right? So it's not going to cost them anything to utilize. Um, but, I kind of go back to what I had said earlier when, they're searching for a solution and, they really don't know where to start. This can be that great starting point, in that vendor research journey. Um, as we expand the platform, we do want it to be really a resource for them. So, if they're looking for specific thought leadership articles, like we do allow our vendors to, um, put webinars in there that they're doing, put thought leadership articles, white papers, things like that. So it can really be a hub and a resource from that perspective. Again, I mentioned conferences. Like we are big believers in conferences, and we know some have travel budgets that are cut and whatnot, but there's some that they might not even know are in their backyard. So making people aware of, hey, here's all the industry conferences that are going on in 2026, and then they can start looking at that too. So um, again, just want it to be a resource hub for them, and a tool that they can utilize moving forward.
So Joel, why was this the right move for you? Like, why take on Martech.health? I mean, you do so many things in the industry. You're connecting people. You were doing those kinds of things. Like, why take on Martech.health? Why was it so attractive to you?
Well, I think you said it. Like the people that know me really know how much I enjoy connecting people. Um, so this is just another way to level that up. Um, whether it's connecting a health system marketer to a vendor to a vendor, a marketer to a marketer, like that's what makes this industry so special is how connected people are and how they want to help out. Um, and Martech.health, we want to do that. And the other thing is like Ed did a really great job. I mean, he had this vision back in 2018 to launch this. Um, and I think there's really a need for this type of platform, and we wanted to see it continue. So, you know, um, when I look at the platform itself, that's why we're so excited about where it can go. And Tony Huth and I, we have a long history. He was the founder of Metacom.Health and my first foray into the industry. Um, so it's great to be able to work with him again. And we're yin and yang. Like he's got his things, I got my stuff, and we trust each other to do everything. We don't have to ask each other for permission. So it's a great partnership to launch it. So.
I love it. Now I can't let you go, Joel, because without asking this next question, because again, you talk to many people, you've been on the circuit. So, when you look at the industry right now, specifically healthcare marketing, what challenges, what opportunities are you seeing? I'm interested in getting your opinion on this.
Yeah, I mean, it's a great question. And I wish I had something kind of really enlightening, but it still comes back to the same things that we've been talking about for the last handful of years. Like they're still being tasked to do more with less. I was just talking to another health system marketer that she lost a big chunk of her marketing team, and now there's 3 of them, and they're just outside a major population market. It's a really, really small team, right? So they're continuing to be stretched more thin and thin. There's still the fragmentation within the health system. You got the marketing team and the other departments, and they're not being as collaborative, and there's the lack of coordination among that. And then you have the mergers and acquisitions still going on. I'm based out of the Twin Cities, so obviously there's big articles every day about the Sutter Health and Allina merger and what's that going to mean to our market here in the Twin Cities. Reimbursement levels become worse and worse. So, like all of those things, yes, there's newer things into the market, like the swear word, I think, AI, that everyone is talking about. But when I look at like what's the biggest opportunity, and I've said this couple different times, but just leverage the people in the industry, right? Like there's some really good vendor partners out there that really truly have a ton of knowledge in all these spaces. Different consultants that work with organizations on how to help navigate these within the health system. They truly want to help, and yeah, I'll say there's a couple out there that I'd probably proceed with caution with, but I think at the heart, like everyone truly wants to help, health system marketers with their day to day. So I guess I would just tell them they're not alone, and do not hesitate to reach out to others in the industry for insights.
I love that. I mean, and a typical Joel answer, if I can say that. Yeah, like don't be afraid to reach out. I mean, and also, what you mentioned about the sometimes dirty word, sometimes amazing word AI, right? It is both incredible what it can do and scary in terms of the impact it's having. Exactly. It's not to get too philosophical about it, but AI is arriving at a time where the world is quite tumultuous. And I mean that in an economic sense, not necessarily a political sense, right?
Yeah.
I mean, it's a tough time, right, out there right now. And we were heading this way even before the first ChatGPT launched, right? Like, yeah. And where I go is if jobs are being lost because of AI, I would say that those jobs were in jeopardy even before AI. Like if the job was so marginal that if a new tool came along, then you could replace that function, then how needed was that function? Not necessarily how good were you at that job. You could have been the best at it, but that function and its value to the organization you were in clearly wasn't that big. So this just accelerated something that was it just happens to be at a really bad time that, you know, this is happening. So
Yeah. No, that's a great way to look at it. And yeah, I think the people that are going to be successful when it comes to AI are the ones that lean into it and embrace it. Like,
right.
how can it make your job more streamlined, easier, effective? I use AI all the time. I pay for ChatGPT and I pay for Claude. Like, both platforms are unique and, have their advantages. So, it is something that I think people need to utilize and just make part of their workflow. Um, and then, as teams are being tasked to do more with less, AI can start helping offload some of that.
Yeah, and the analogy I use to give people some hope. I mean, it sucks if you've lost your job for any reason. It sucks a little bit. It's a little bit of extra sting if AI is the suspected reason. But way back in the day, and I remember these days when typesetters were a thing. Right? People had careers as typesetters, right? Like back in the print press days, you would have people who laid out the fonts and the actual printed, templates that would then run off all the papers, right? So you had these typesetters. And then along came like typesetting software, right? Like, and in the early days, like no one knew how to use them. They were horrible to use, but they got better a lot faster. And then all of a sudden, one day, the switch flipped, and no one needed typesetters anymore, right? And they were all out of work. Well, guess what happened to all those typesetters, right? They became graphics designers,
Right.
Like that's what they migrated to because it was a very similar type of thinking and skill set, just applied in a different way. So not just dealing with fonts and layouts and sizes, but now the entire canvas. And because software caught up, right? So, so you look at the two jobs and you go, well, what would you rather have been, a typesetter or a graphic designer, right? Over the last few decades, the answer is, of course, you want to be a graphic designer, but that switch happened, and in the middle of it, it was horrible for typesetters, but at the end of it, a better role came through it, right? And so I think to your point, if you can navigate through it, if you can find some new skills and find a way to embrace this technology or something else, then I think you'll be back, back in the roles that you want or in better ones.
Yeah. No, exactly. So.
Well, Joel, this has been fantastic to catch up with you. I could talk with you for hours. Final question for you. Where can people go to connect with you and to learn more about Martech.health?
LinkedIn's always a good place. Looking me up there. You can email me at joel@martech.health as well. But yeah, always here if anyone has any questions or just wants to pick my brain. So
awesome, Joel. Well, pleasure having you on the program. As always, can't wait for the next time.
All right. Appreciate it, Colin. See you at the next conference.
I want to thank Joel for joining me on camera. I always appreciate how thoughtful he is when he responds to questions. He's one of the people I turn to get a pulse on the market. He's truly a great connector. And I'm excited for what he and Tony have in store for Martech.health. It's definitely a needed resource, and I would encourage all of you to check it out. And hey, if you made it this far in the video, we'd really appreciate it if you mash that like button and click subscribe. Also, head on over to Swaay.Health, that's Swaay with 2 A's, .health, where you can find more great content like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.
Swaay.Health.